Dear students, welcome back. In the previous session, we have discussed about coordinated motions of the femur, pelvis and lumbar spine, that is lumbar pelvic rhythm. Now in this session, we are going to discuss about the hip musculature. Okay. So in the hip joint musculature, there have been numerous studies of muscles of the hip joint. Most confirm underlying principles of muscle physiology, and this hip joint muscle work best in the middle of their contractile range or on a slight stretch. This slight stretch means so-called optimal length tension. Okay, and the two joint muscles, that means the muscle which is crossing two joints, generate greatest force when not required to shorten at both the joints simultaneously, and the tension generation is optimal with eccentric contraction, which is followed by isometric contraction and then the concentric contractions. The muscles of the hip joint has their most important contribution to function during weight bearing. In weight bearing, the muscles are called on to move or support the head, arm and trunk's weight. That means 2/3 of the body weight rather than the weight of one lower limb. So that lower limb forms 1/6 of body weight. For example, head, trunk and arms constitutes 2/3 of the body weight, and if you take each limb is having 1/6 of total body weight. 1/6 of total body weight. So that means it is more worried about to support the upper body weight, that is 2/3 body weight, rather than the 1/6 body weight, that is another lower limb. Okay, so for that reason, the hip joint muscles adapt their structure to the required function, as can be seen in their large areas of attachment, okay, and their length, their large cross sections. So all these help to maintain the most important function, that is weight bearing of the upper 2/3 of the body weight. Okay, the alignment of the hip joint muscles and the large range of motion available at the hip joint result in muscle functions that are strongly influenced by the hip joint position. For example, the adductor muscles may be hip flexors in the neutral hip joint, but will be hip extensors when hip joint is already flexed. And also some of the studies done by some investigators, they used computer modeling to determine the torque generating capability of the medial rotators increased with the hip flexion, whereas the torque generated capacity of the lateral rotators decreased with increasing hip flexion. They similarly determined that the piriformis was a lateral rotator at 0 degrees of hip flexion, but it also acts as a medial rotator at 90 degrees of hip flexion. So such kind of innervations of functions are also found in few muscles at the shoulder level, that is clavicular portion of the pectoralis major. Okay, so the same type here in the hip joint also. Okay, and there are, as a consequence, results of various studies may appear to be some contradictory, but in fact testing conditions explain differing results. some gender related differences also have been found that to explain differential findings. So that means here the hip joint function of the muscles is varied according to the hip joint position. Okay, so it is best to examine muscle action at the hip joint by considering some specific functions such as single limb support, posture and gait. Okay, so if you consider in these three aspects, we can determine the exact action of the muscles. So all this appears to be the hip musculature will have some complex function at the hip joint, and which is strongly influenced by the hip joint position. So although all these things are evidenced by some investigators, but now we are going to discuss about the traditional action of each muscle on the distal femoral segment to analyze the muscle functions. So as we know that the hip joint is a ball and socket type of variety. It undergoes 3 degrees of freedom of motion. So that means it is having flexion extension in sagittal plane and abduction adduction in the coronal plane and medial rotation and lateral rotation in the transverse plane. Now we are going to discuss about each group of muscles. That means the group of muscles which helps in flexion, that is flexors, how these muscles are going to help, and which there are many muscles which help in flexion. So what are the primary muscles which helps in flexion and what are the secondary flexors? Like that in all group now we are going to discuss. Now first we are going to discuss about the flexors of the hip joint. So the flexors of the hip joint function primarily as mobility muscles that bring the lower extremity forward during ambulation or in various sports like open kinematic chain. And the flexor may function secondarily to resist strong hip extension forces generally occurring in closed kinematic chain. So the main function of flexors are mobility, which acts as a mobility muscles during open kinematic chain, and the next function of this flexors is to resist strong hip extension forces generally occurring in closed kinematic chain. Okay, these are the main two functions which are carried out by this flexors at the hip joint. Okay, there are 9 muscles that have action lines crossing the anterior aspect of the hip joint. So anterior aspect of the hip joint. So 9 muscles. Out of these, the primary muscles of the hip flexion are iliopsoas muscle. This is psoas major and this one is iliacus. These two together unite to form a single tendon which is getting inserted on the lesser trochanter, forming a common muscle called iliopsoas. So this iliopsoas is the primary muscle, and then this is the rectus femoris. So this is one of the muscle in the quadriceps. So that rectus muscle, rectus femoris, and then the tensor fascia lata and sartorius. So normally the sartorius, which is originating from the anterior superior iliac spine, and lateral to this muscle, so this tensor fascia lata is originating. Okay, these are the 4 major or primary muscles which helps in hip flexion. Okay, out of these 4 muscles, the iliopsoas muscle is considered to be the most important of the primary hip flexors. And it consists of two separate muscles. One is iliacus and the psoas major muscle, which attached to the femur by a common tendon. So that these two components of the iliopsoas have many points of origin, including the iliac fossa. Iliacus is originating from the iliac fossa, whereas the psoas major will have multiple origin points. And also here you from the anterior aspect of the bodies of the upper four lumbar vertebrae is also giving origin to the psoas major muscle. Okay, and also the transverse processes of the lumbar vertebrae for the psoas major. Iliacus is originating from the iliac fossa. All these two will get inserted at the lesser trochanter. Okay. And it is this psoas major is also originating from T12 also, as well as some part of L5. Now, the attachment of psoas major to the anterior vertebrae and the iliacus to the iliac fossa make it likely the activity or tension in these muscles may increase lumbar lordosis by pulling the lumbar curvature anteriorly. Okay, that means when during the flexion or pulling of these muscles on the anterior aspect, which also causes some anterior flexion of the lumbar spine. Okay, and these two helps in the hip flexion. Contraction of these two muscles causes hip flexion. The other function is because of contraction of iliopsoas major causes lumbar flexion. That means it increase not flexion, lumbar curvature. It increases the lumbar curvature anteriorly. Okay. So it is having during hip flexion there is a concomitant medial and lateral rotatory function is also appeared, but it should be ignored. Okay, so the major action is hip flexion by the iliopsoas muscle. Next, coming to the rectus femoris muscle. So this is the only portion of the quadricep muscle that crosses both the hip joint and knee joint. It originates on the anterior inferior iliac spine and inserts by a common way tendon into the tibial tuberosity. Okay. And the rectus femoris flexes the hip joint. So it helps in the flexion of the hip joint and extension at the knee joint. As it is a two joint muscle, one joint acts as at one joint it acts as hip flexor, okay, and the other joint it acts as knee extension. As a two joint hip flexor, the position of the knee during hip flexion will affect its ability to generate force at the hip. Simultaneous hip flexion and knee extension, simultaneously hip flexion as well as knee extension considerably shorten this muscle and increase the active insufficiency. So the rectus femoris makes its best contribution in the hip flexion when the knee is maintained in flexion. So already we have seen in the osteokinematics, the hip flexion is restricted to 90 degrees when the knee is extended. When the knee is flexed, the hip flexion is increased to 125 degrees. So this is the reason why, because the two joint muscle which is crossing the hip as well as knee joint creates active insufficiency there. Okay, and the next muscle called as sartorius. Okay, this is the sartorius muscle. The sartorius muscle is a strap-like muscle originating on the anterior superior iliac spine. It crosses the anterior aspect of the femur to insert into the upper portion of the medial aspect of the tibia. The sartorius is considered to be a flexor and abductor of the hip, as well as flexor and medial rotator of the knee. Okay, although it is a two joint muscle, the sartorius does not appear to be affected by the position of the knee, because its cross-sectional area, if you can see, it's a strap-like muscle. Its cross-sectional area is very much less. Okay, and also the relatively small proportional change in the length with increased knee flexion, it is active when the knee is either flexed or extended. It does not affect any function, and it is active when the knee is flexion or extended. That means here, although it is crossing knee, but it does not affect the range of motion at the hip joint. So that is the function of sartorius here. And next muscle is the tensor fasciae lata. Muscle originates more laterally than the sartorius. Okay, its origin is on the anterolateral lip of the iliac crest. The muscle fibers extend only about 1/4 of the way down the lateral aspect of the thigh before inserting into the iliotibial tract. Okay, the tensor fasciae lata is considered to flex, okay, and also abduct and medially rotate the femur at the hip. Although the tensor's contribution to hip abduction, which is mainly dependent on the simultaneous hip flexion. Okay, the most important contribution of the tensor fasciae lata is to maintain tension in the iliotibial band. Stretched from the iliac crest to the tibia, the iliotibial band is considered to assist in relieving the femur of some of the tensile stresses imposed on the shaft by weight-bearing forces. Okay, and this is the major function of this tensor fascia lata. Okay, next, if you see the secondary flexors are the pectineus, so pectineus, adductor longus, okay, adductor magnus, and also gracilis muscle, so which are help in flexion, but it is having a major contribution in adduction. Okay, these muscles contribute to flexion only between 40 to 50 degrees of hip flexion. Before and after that range of hip flexion, these muscles are not going to work in hip flexion. So this is one of the important functions of the secondary flexors. And also the gracilis is the only two joint muscle in the adductor group. It is active as a hip flexor when knee is extended, but not when knee is flexed. So this is all about the flexors of the hip joint musculature. In the next session, we are going to discuss about the remaining groups of muscles which helps in different actions. Thank you.